I've interviewed lots of pharmacy students over that time, and everyone says they want to go to pharmacy school to help people. And so many pharmacists right now are just not feeling like they're doing that in their daily job. And so I really feel like this gives them an avenue to do that.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional pharmacy careers. The PharmD opens so many doors, and by listening in, you will have the opportunity to learn from experts in the field on how to start your own journey. In today's episode, I have the pleasure of speaking with Dr. Melody Hartzler. Dr. Hartzler is a family medicine clinical pharmacist and associate professor of pharmacy practice. Dr. Hartzler graduated from Ohio Northern Raabe College of Pharmacy, after which she completed a PGY-1 Pharmacy Practice Residency in Columbus, Ohio, with an emphasis on ambulatory care. Following residency, she joined faculty at Cedarville University School of Pharmacy and developed a collaborative practice in a family medicine residency program. She now splits her time working for Cedarville University School of Pharmacy, as well as serving as a clinical pharmacist at Western medicine providers. Her primary practice and interests include diabetes, pulmonology, and integrative and functional medicine. She also uses her own blog, PharmToTable.Life, as a platform to educate patients and healthcare providers about functional medicine services. Welcome to the show, Dr. Hartzler.
Hi, thank you. Thanks for having me.
Yeah, I'm really excited. I think we have a lot of interesting things to talk about today, especially like from the entrepreneurial side of things and how you started your business. But I want to take things way back. How did you actually start out in pharmacy? What caused you to pursue a career in this profession?
Yeah. So my mother was a nurse or is a nurse still. She should be retired, but she's still working on the floor. And so I saw her and how she developed relationships with people and how she was able to help them and be there for them in their times of need. So just the high schooler math and science interest, it sort of led me to pharmacy. Although I personally, when she would tell the stories of the nursing, side of things, the gross stuff per se, and the blood and all of that, I was like, yeah, that's not really me. I actually had an experience when I was in pharmacy school on my last rotation that I was at a pediatric burn hospital, and I was with this nurse, and this poor child was 70% body surface area burn and pseudomonas and the smell and the heat in the room. And the nurse was like, are you okay? And I'm like, no, I can't see you anymore. So it's that kind of thing is not my thing. So that was one of the reasons why I went into pharmacy school, because I was like, okay. And at the time, pharmacists weren't doing as many physical assessment things as we are now and other things. But that was probably what led me to pick that over medicine. And I think also just knowing that I wanted a family and wanted flexibility, I just at the time felt like medicine was a little too much for what my, overall life goals, I guess, were. So that's why I ended up in pharmacy.
Absolutely. Yeah. I actually, it's funny. I fainted at less than that, but,
really?
Still stomach it. You just have to get used to it.
You just have to get used to it. All right. Well, I'll think about that. I've definitely thought about, we could get into this, one of the challenges of pharmacists is not being able to prescribe without the collaborative practice agreement. So I've thought about going back to PA school and just being able to blend the two. But then all the surgery rotations in PA school, because it's so surgical focused, I was like, I don't think I can do that.
Yeah, that's a very interesting hybrid
we'll
approach right there. I haven't really considered it too much, but wow, that's
yeah,
definitely something we could explore later on. But more about you. So you obviously went to pharmacy school and
went to Ohio Northern,
and you then went to a pharmacy residency and you did a PGY-1.
Yeah.
Can you tell us a little bit about that and what kind of did you do that?
Sure. Yeah. So I'd worked retail as a high schooler. So that was another reason for going into pharmacy, was that I applied at all the pharmacies around town and got a call from one of them that was opening a new store. And so I started at 16 or 17 before the tech laws changed and you had to be older. And so started as a pharmacy cashier and worked my way up there. And so, as far as like once I worked all the way through pharmacy school as an intern for this chain. And then I think, I saw that I could do that job and I saw that it was important, but I knew like physically that I probably couldn't do that for the rest of my life and standing on my feet 8 to 10 hours a day and just the stressful components of it. And so I really wanted something where I could form more long-term relationships with patients. And I also I saw even from the beginning that I wanted to help people not need medication and be able to help, doing more of that education, especially when it comes to the diet and lifestyle components. And unfortunately, our community pharmacists, as amazing as they are, don't have the opportunity often to really spend that time with patients. So that's really what led me to ambulatory care. And so I always laugh because pharmacists call it ambulatory care, but if any physicians are listening, they're like, what in the world is that, right? Because really, it's really more primary care when we talk about it from a physician or medical perspective. And so really the VA residency was appealing to me because pharmacists have been at the forefront of primary care in the VA for a really long time. And so the pharmacists were embedded with the primary care clinics. They were doing diabetes management. They were serving in Coumadin clinics and renal clinics and lipid clinics. And so the ability there to see all of those different things and train under the other pharmacists that were doing that was really great. And also that particular program was unique because it was at the PGY-1 level, where a lot of programs like that are more at the PGY-2 level. So I knew like, this is what I want to do. I, did hospital rotations in pharmacy school and was like, I do not want to do that. I want to keep people out of the hospital. And so I just really knew that was what I wanted to do. So it was a really good fit for me.
Wow, that's awesome. I'm so glad that you're able to find that just within 1 year too. Like you said, that's kind of transitioned into a 2-year process now. And as people further subspecialize into their specialties, but specifically, so do you have any recommendations for individuals who are kind of getting out of pharmacy school right now, or approaching that end period? What could they do right now to kind of make themselves more competitive to get some of these positions?
Sure. I mean, certainly we're past the residency. Well, I guess by the time this is being listened to, we're probably in the next class of cycle of looking for residency. But I mean, certainly looking for programs that if they don't have like a whole year focus on ambulatory care, if that's something you're interested in, looking for ones that at least have 2 or 3 months, or you can use your elective months to be able to do, if they have clinical services that are able to be electives, that's an option. I mean, I've worked with programs here in my local city where, I was in a family medicine office, and one of the residents at a local hospital wanted to do an out rotation with me. And so we were able to set that up to where they could come over and do that rotation. So maybe even talking to residence directors as they're pursuing programs and say, okay, I know you don't have a focus on ambulatory care. Do you have any relationships with the local university that has ambulatory care faculty, or another, faculty member in town that maybe has residency preceptor experience that they could actually set something like that up? So if you have the opportunity to make it open, I think that's important because PGY2 in prime, you probably don't, unless you're going to really, really specialize. If you have a foundational PGY1 and have 2 or 3 months of that experience in ambulatory care, I think people can generally jump into a position that's focused in ambulatory care. At least that's my experience. I did a residency at the last site I was at. I actually had 4 residents. 1 year I took a PGY1, and the next years I took PGY2s. And I mean, the PGY1 did just as well, acclimating to that site as the others. The others definitely had a little bit more background in transitions of care, especially, that hospital to outpatient, process that we were involved with. And so certainly that brings, the hospital experience is never going to hurt you or the other clinical experience, especially if you're going to be involved in transitions of care. But I don't think it should be a requirement. And really, pharmacists can jump into primary care at any place. They don't need a residency necessarily to do that. So as far as like other training opportunities, there's a lot of certificate programs. Certainly, ASHP has several certificate programs. The American Pharmacists Association has a diabetes training program. There's things like the diabetes educator certificate. So those things do require like hours and counseling before you can actually be certified. So you do have to figure out what that looks like. But there's one specifically for clinicians that I have called the Board Certified Advanced Diabetes Management. And that one does less hours than the educator. So if you can get into a place and, whether you're doing it from an entrepreneur standpoint or you're, figuring out what it looks like to build out a position whether you're in a hospital and you're trying to like expand services in your hospital, getting some of those hours in might allow you to go through some of those certification processes. But they have the Diabetes Educator organization certainly is a great place to look, or even the ADA on specific to diabetes training. And really reason why I say diabetes is because that's so much of what primary care is struggling with as far as the low hanging fruit of like pharmacist involvement is really helping taking the provider burden off and allowing the pharmacist to centralize some of that and be sort of that diabetes specialist. Because unfortunately, endocrinology, while they're amazing, like in my town, we have very limited endocrinology resources. All of them are great, but they're, I trained for one of the pump companies, and I tried to call and help a patient get a scheduled appointment because there was some things they needed to figure out before they went to the pump, and the next available appointment is like 3 months away. And so really pharmacists have an opportunity to come into those primary care practices and say, hey, like there's a need here. Your patients need help getting their diabetes better managed, and we can come in and create that model that works so that patients can get better care. And the ones that really need that endocrine support can still get there, but then there'll be less burdening that system as well.
Wow, so definitely a lot of information to unpack there.
Yeah.
But essentially, what you're recommending is that any individual, any pharmacist, whether they're about to graduate or has graduated, obtains some of this further educational credits to basically allow them to operate in different areas and kind of make themselves not only more marketable, but then that they can also kind of unburden the healthcare system by using their skill set that probably is.
Yeah, absolutely.
Mm-hmm. That's awesome. So cool. A lot of good advice there for the listeners. So I definitely recommend you do all of those things. And so I think, that kind of provides a good segue to talk about like just how medical practice is kind of operating as a whole. And there are a lot of downsides to this. In our discussions that we had prior to the recording, we talked a little bit about like the 15-minute medicine model. Can you tell us a little bit more about that and how that's kind of impacted care as a whole?
Yeah. I mean, if you think about the average time that someone spends with their provider when they go to the doctor's office, it actually may even be less than 15 minutes that the provider is even in the room with the patient. And so certainly there's a lot of work in health systems and places to, have the provider be able to spend more time because we're looking more at pay for performance now than this direct reimbursement for this visit and that one interaction. But unfortunately, there's still this transactional thing that happens when you come in and the physician bills and there's that billing reimbursement. And so because of that, sometimes offices are pressured to see more and more patients. And sometimes, it depends on the place, it depends on the leadership and all of that and how efficient they are with the rest of the office as far as the staffing. But in reality, what's happening across America is that providers are not able to spend as much time with patients. And so I always say, like, when I'm talking to primary care providers, like, you guys could do just as good as a job with diabetes if you had 30 to 40 minutes to sit down with this patient too, because the patients in 15 minutes, normally they can't unpack like all of the contributing factors to diabetes. If you're trying to talk to them about lifestyle and the barriers that they're having to making lifestyle changes, why they couldn't pick up their medication, if you're trying to talk to them about side effects they had in the past when they tried all these XYZ other drugs, and you're trying to unpack that whole history, it really does take at least 30 minutes, if not 45 minutes, if it's a new patient. And so to be able to sit down with them and figure all those things out takes time, and figuring out how you do that in your office. And I find that when we put a pharmacist in the office, and one of my team, Prefero team is one of the organizations that I work with, and we put pharmacists in physician offices as part of our business model. But part of that also, like I said before, takes the burden off the provider. So now when the provider sees the patient, they used to have to spend that whole 15 minutes talking to the patient about their diabetes, because you could talk for, like I said, 30 to 45 minutes or more about that. And so now they can say, oh, review the pharmacist note. Okay, great. You're moving forward with this. You made these adjustments. Any questions you have about that plan? Okay, great. Let's talk about your screening for your colonoscopy. Let's talk about your pain. Let's talk about your cardiology referral, something else in that time. And then, the pharmacist was able to see them within a few weeks of their last appointment. Then they, sort of have this back and forth until the patient gets controlled. And then as the patient gets controlled, the pharmacist doesn't have to see them as often. And again, both providers can do more things with that patient and get to more, improving the outcomes across the board, and not just being so consumed with that. So, and again, like if we had that model of in our town where I have to refer to endocrinology, they might not get in for 3 months, which means 3 more months uncontrolled A1C and, specifically to diabetes, but other conditions, whether you're, using a pharmacist to help with your transitions of care in your COPD population or your CHF population that gets hospitalized frequently, really being able to have that care in house. And, we used to use the term patient-centered medical home. I don't know if we're still using that term because now we're using CPC Plus and all these other pay-for-performance type programs, but I mean, the pharmacist can really drive the performance measures and provide, there are ways to bill for the pharmacist time, whether you're doing it CCM, RPM, direct, depending on the state, we can actually bill direct providers in some places. Like in Ohio, we are considered providers on our Medicaid plans. And so we can bill directly just like a physician or PA or nurse practitioner can to the plan. So there's lots of different financial models depending on, where you are. And that's a little bit the confusing part because it's not standardized across the board like it is for other healthcare providers, but there's definitely ways to incorporate that and also, benefit from the additional pay for performance revenue.
Yeah, you're definitely right. I think like one of the challenges with this 15-minute model, like you kind of expressed, is the second I walk into a room, I start a timer, like mental timer, and you're just sitting there and they're like, all right, go, start talking.
Yes.
And that is not how medicine should be done. And,
and then they tell you they take the white pill with and then the blue pill, and then you're trying to figure out, what that is. And so it takes a while. And a lot of, if you think about the literacy and the health literacy levels across the board, depending on what kind of population you're serving, the 15 minutes is not enough.
Yeah, as the pharmacy, I guess the original pharmacist in me is like screaming inside. I was like, I want to talk about all these medications and all these, interventions that we can improve compliance and all this stuff. And I don't have time. I'm doing the physical exam while I'm like listening about, you have chest pain. Now we have to do an EKG and we can't talk about the diabetes anymore.
So exactly.
Yeah, it's definitely a flawed system. And I think you're right, by introducing pharmacists into that playing field, it kind of allows for better outcomes. And like you said, better reimbursement for just everyone as a whole. Mm-hmm. And so additionally, do you think like because of this, like I feel like there's so much documentation that goes into like healthcare nowadays too, as well as like we feel like we're just checking the boxes and going through the systems. Mm-hmm. Do you think a lot of that has like contributed to burnout, just like as a whole in every kind of healthcare professional?
Yeah, I think so. I mean, I think one of the challenges for me, like when you said checking the boxes, it really reminded me like a lot of healthcare systems that are using like health coaches or MAs or LPNs to do some of these care management things. I feel like sometimes it is like that. They're just calling like, I called this person for this period of time, or I, asked them to do their colonoscopy. I checked the box here. But like oftentimes care isn't improving based on like those conversations. And so I really, go back to this pharmacist driven model where if my nurse is reaching out and finds out the patient has a high blood sugar or high blood pressure, the pharmacist in the collaborative practice agreement can just take care of that. They don't have to send a message back to the physician to be able to say, hey, what do you want to do about this? I mean, certainly there's some times where we want their opinion if we're, got a serious situation, but if it's within your collaborative practice and your scope to be able to just adjust that, make the change, and then that time was well spent, right? Instead of like this back and forth all the time in the charts. That's what drives me crazy. I mean, even me trying to call a provider's office, if you want to talk to your doctor, you can't talk to your doctor, right? You have to leave a message. They have to transcribe that to your provider. The provider then transcribes the message back to the MA or the LPN, and then they call you back. I just think that's like such a waste of time. Why don't we give our providers like an afternoon a week to actually make those communications? Because when I was, in the primary care office, I was always giving patients my direct line. I'm like, just call me. It's so much more efficient. We'll just take care of it. And sometimes that means I had a lot of voicemail to answer, and I did have admin time built in to address that. But anyway, so I just get on the soapbox about that sometimes because I just feel like it's so inefficient. And one of the reasons why a lot of physicians are moving to concierge models because they then can care for their core patient population and actually have that relationship and provide them the ability to communicate back with them. But as far as like the pharmacist burnout, I mean, certainly in community pharmacies, it's real right now. There are so many people that are just, it's numbers, the fees that are being applied at the PBM side and the actual reimbursement back to the pharmacy is dwindling. Some pharmacies are losing money filling brand name prescriptions, which to me is like, how is this even possible? Like, this has been going on for years, even since I worked in retail, that you would look at a claim and you're like, okay, we lost $3 on that. And we just, fill this. So, or sometimes it's hundreds of dollars. And so a lot of independents that are on this entrepreneurial journey are closing because they can't, they don't have the ability to lose all that money and still stay afloat. And so that's frustrating. The payment model is certainly frustrating on the pharmacy end, but even in the ambulatory care space, I think there is some times where we seem like we're saying the same thing over and over and over, whether it's the same thing to our administration or same thing to our patients. And so I think that's one of the reasons that I love group visits. I don't know if you've explored any of the literature around group visits, but we did a study and it's published in Diabetes Educator, but it is a study that we did group visits in a federal qualified healthcare center. And it just was, and again, back on the efficiency, and maybe it's because I'm married to an engineer, but to be able to actually educate everyone in like one swell swoop, like, okay. And the best part about group visits is that the patients then learn from each other. So it's not Melody, who doesn't have diabetes, telling them what to do. It's this person sitting next to them that also struggles with diabetes and also is, doing this life that's actually communicating with each other. Or someone says, oh, I did have that side effect at first, but it went away. And for some reason, that's like 100% more powerful than me telling them the side effect is going to go in a few weeks. So I think group visits are definitely a model that helps reduce the workload and the burden for offices for people that do feel like they're just struggling to stay. It is a little bit challenging from a scheduling standpoint. So you definitely have to have some ancillary staff helping with the scheduling and managing, the notes and things during, if you're seeing 10 patients at once, the documentation load afterwards is a little bit rough, but overall it can be helpful. But I do think like having more members of the team, I think about some of the nurse practitioners I've worked with in busy primary care practices and even physicians that, they do feel that less of a burden when there's someone else there to take over this really complicated patient that you're just like, oh my goodness, I don't know what to do with this person, but I got to move on to the next person, right? In that normal medical model. So a lot of times we would just get pulled into a visit, especially when I had a resident, there was two of us, one of us would, get pulled in, and this person's A1C 16, this is the presentation. Okay, I got to go to the next appointment here. Take it over. So I think that part really helps alleviate some of that stress on the other providers is having, so that back end support.
Absolutely. I definitely think that having more like collaborative practice agreements on board can just really help with, I think it just helps like minimize some of those like miniature transitions of care where like I have to then pull up the chart and see what's going on when you're currently in the chart and know the recommendation right then and there.
Yeah.
Having a set kind of guidelines for paperwork of all the stuff, like just handle it, I trust you.
Right. I know. And part of it is that trust. And I think that's where it is a little bit challenging sometimes for pharmacists to make this connection to primary care, because if they don't have like that relationship with someone, you probably wouldn't trust just anyone, pharmacist off the street, like making changes in your patient's medication, especially if you've never been familiar with the whole concept of pharmacy and pharmacist. So it is building trust. And I think that's the one thing I would tell pharmacists that are looking to do this type of work and maybe didn't do residency or that traditional path is really just find those places where you can network with physicians, because building the trust up front is really one of the most important things to, building the next step.
Absolutely. And so kind of building off of all of that, I want to talk a little bit more about your business model and what you've actually created. So on this podcast, we focus on like non-traditional pharmacy careers, and you definitely fit the bill for that. So I think it's super exciting that you've created this company called PharmToTable that kind of serves as a platform to provide healthcare information and care. And it primarily focuses on like what you call the root cause of chronic illness. Can you tell us a little bit more about that?
Yeah. So I feel like we could probably talk for hours about this journey, but basically I discovered functional and integrative medicine, and I discovered that because of my own health journey. So I had a child in 2014 and she was colicky. It was a nightmare. Honestly, I didn't sleep for like 3 months, and just the whole birthing experience, I think, was just my like trigger to stress when my body, already had some things that probably weren't set up great, like poor diet and as a child, poor gut health, probably based on even just like formula fed, all those things that, back in the day, happens, but do set your body up for success or not, or turning on and off different things as far as, risk factors. But so I had that happen. And then I started to have really bad abdominal pain, bloating, all of these symptoms. My daughter started having food allergies, was reacting to like 4 or 5 different things when we started introducing solids. And so I was like, and there's something that has to be different about this. Like, what's going on? And so I finally got one provider to order some like more functional oriented testing, although he probably wasn't the best fit. And it took me about a year to really discover, okay, I probably had small intestinal bacterial overgrowth, and this is, the appropriate treatment. Even going to GI, like I had to really convince them that this is, treatment that would be recommended for this. So it took me, 1 to 2 years probably to really get myself healthy and enough to where I felt like I, could then move on with trying to expand our family. But in the midst of that, the stress and all of that caused hormone imbalances. At one point I checked my hormones. They're like postmenopausal. I had after I finished breastfeeding my daughter, I didn't have another cycle for like 9 months. And so I went to one physician who's actually a faculty member up in the Cleveland area. And she was like, you're not getting this back without acupuncture. And I was like, acupuncture, and that's a whole nother world of like a integrative modality that I haven't considered. So I started acupuncture. I started some supplementation, got my cycle back within a few months. And then I got pregnant with my son the following spring, summer timeframe. And so just all the things that I learned during that time, I was like, okay, I got to start telling other people about this. People are starting to ask me questions about this. And so that's really where Farm to Table became. When I had my son in 2017, I started blogging, and really just my original intent was just to tell people, instead of them asking me what probiotic they should take, I'm going to just send them this article that I wrote about the probiotic, and maybe I'll make a little money off of something with the, eventually with ads or something to pay for their sports or their piano lessons. It wasn't my intent necessarily to like turn it into a business at that point. But then I think with all entrepreneurs, there's always like this like need that you're trying to fill, right? If you're really developing a business that is something that is needed, you're trying to fill that gap in some kind of situation. And so for me, I started educating more pharmacists about this. There's another pharmacist named Lauren Castle who started the Functional Medicine Pharmacist Alliance. And so I connected with her, and then other people, started thinking there's not a lot of pharmacy education surrounding these topics. There's Institute of Functional Medicine, which is great, and they are a great partner of ours. There's, A4M that's been educating pharmacists on this, but they're all just organizations that are focused on all kinds of specialties. There wasn't a specific pharmacy organization. And so in 2000, fast forward 2 years, in 2019, all these pharmacists just kept saying, well, where do I get CE on this? Where do I get CE on this? And I was like, well, I mean, maybe this place, maybe that place, but they don't really offer pharmacy CE. They're only offering CME. So I was like, okay, I've got this question enough. And I had submitted proposals to a national pharmacy organization twice in that time frame and gotten denied. And the reason for denial was not enough interest. And I was like, okay, all these people are asking me where they can get CE, but this organization is saying there's not enough interest. So what do I do? And so my husband is a web developer. And I said, okay, and I know how to do CE. I was a faculty member at the time. I've put together plenty of CE programs. Most of them were focused on diabetes. And at one of the conferences, a national pharmacy conference, I did a presentation about pre-diabetes. It was like in a 30-minute segment of an hour and a half presentation, but it was talking about zinc deficiency and how zinc can help, with preventing the conversion to diabetes, and prebiotics and probiotics. And I mean, I had a line out the door of people that were like, hey, I want to ask you questions about this afterwards. And so in 2019, we launched functionalmedicinece.com as part of Farm to Table. And so this website is focused on educating pharmacists, providing CE for pharmacists to help on these, especially if they want to focus their career in this area. They don't necessarily want to do other CE about new drugs or this or that. So they want to do CE that's relevant to what they want to do. So I started that in 2019. Our first conference, we had like 70 people join, which was amazing. And it was a virtual all-day event. I think the other thing I realized in talking to pharmacists was that they didn't have the money or the time to spend a week at one of these national meetings for these other organizations, especially pharmacy owners. They're trying to staff their pharmacy. They just need something that they can just like sign on, sign off. Certainly sometimes they go to weekend events, but it wasn't like they could always be doing that. And money, you know that CE money has dwindled over time, especially in the pharmacy world, where a lot of companies don't provide CE funds for pharmacists. I think it's a little different on the medical side. We're still seeing that being provided more. But so for pharmacists, it was like, okay, I need something inexpensive and I need something convenient that I can learn more about this. And so that's where we launched Functional Medicine CE as a virtual product. Like, hey, we're going to do virtual conferences. Well, then here comes COVID in 2020, and everybody's got virtual online education. So that sort of slowed our momentum a little bit, because I feel like everyone was like tired of Zoom and not wanting to Zoom. But there's still a good number of people joined our conference actually in February of 2020 before everything went down. And then we had, multiple conferences. We had about 3 conferences a year for a couple years. And then now we're doing 2 conferences a year and releasing on-demand education as well. But through that process, I started to get questions from pharmacists. Okay, now I know this information. What do I do with it? How do I implement it? And that's really where the Farm to Table side was born. So I had the blog already with Farm to Table, but I started to, help these women, mostly women, came to me and like, hey, I want to do this, but I don't want to be a business owner. I don't want to own my own business, but there's no jobs out there that are posted functional medicine pharmacists wanted, right? Like that wasn't like a thing. So in order for them to step into this career, they either had to do it in their current practice setting, which is possible. And we teach a lot about that. Like, how do we make these interventions, whether you're in primary care or community pharmacy or even in the hospital, like what are the things that we can do? But a lot of people wanted to move more into that consulting space. And so that's really where it was spring of 2020, I had a webinar and I said, hey, this is my vision. who wants to join me? And so I had about 7 or 8 people that were like, yes, we're in for this. And so we started the PharmTable team then. I invested all the money I made in that conference in the fall of 2020 into an EHR and had them build out this marketplace for us. And so on our marketplace, we have pharmacist visits. Pharmacists can be part of our team, or they can use the marketplace on their own. And the pharmacist is actually driving this root cause medicine approach. So the pharmacist does the evaluation with the patient, spends about an hour with the patient on their first encounter with us. We go through their history. We look at all their labs that they've done, any screenings they've done. We talk about things all the way back to birth. Like I mentioned, we talk about, what your childhood looked like, what stressors did you have? If your parents got divorced, when did that happen? Like, did that trigger any kind of traumatic, do you have trauma? So how is that all, falling into place, and where does it align with some of where these symptoms started to occur? And then we do make recommendations for lab orders that get signed off by a physician that's on our telehealth marketplace network. And then those patients can go use their insurance for labs, and they can also then, have an appointment with us to be able to go over those labs afterwards. And so most of what we're doing there, we're not diagnosing anything. We're just really helping to try to find imbalances. Most of the patients that come to us already have some kind of diagnosis. And I always give the example of IBS because IBS is really, as you know, like just a collection of symptoms that we're labeling. Like this Rome criteria is really just like, okay, you have constipation, you have bloating, you have this. It's not necessarily telling us the etiology of what's going on. But we learn because Pimentel's research and the Cedar-Sinai, they've got all kinds of cool stuff about that. And we're learning more about small intestinal bacterial overgrowth as it relates to IBS. But like the cause of the IBS in a lot of cases is that bacterial imbalance, right? And so we have to fix that bacterial imbalance. I'm not necessarily they already have a diagnosis of IBS, but we're just helping them really get to that root cause. Sometimes it's, inflammation. I mean, we still see low-grade inflammation in IBS, even though it's not IBD. And so talking to them about nutrition, elimination diets, things like that, depending on what it is. And then medication-related nutrient depletions is a huge place for pharmacists to get involved in this as well. I mean, we know the big ones, like metformin causes B12 depletion, statins cause CoQ10 depletion, but there's a lot of smaller things like, blood pressure medicines depleting magnesium and other things like that that can really be affecting people's health. And so those are some of the things that we're talking about. So we're coming up with a plan with patients. It might include probiotics, it might include herbals, it might include other nutrients and supplements. And then we're following up with that patient. Maybe it depends on how, often that's needed for that case. But so we're doing that. And a lot of physicians are out there doing that. A lot of nurse practitioners are out there doing that as well. And we're all about, the more people that can be preaching this message of there's, underlying causes to a lot of these conditions, the better. So we partner with pharmacies. We have contract with pharmacies where we do MTM for them. And then we talk to patients about some of these nutrient depletion things. And then also the pharmacy tells them about our services. We have contracts with other functional medicine practices that need additional pharmacy input. So one of the practices is a PA group. They have a physician oversight, but they're a group of PAs doing functional medicine, and they have found that their experience as PAs, they both were ER trained. So they saw a lot of like acute things. And then they also practiced in a functional medicine clinic, but they never really managed medications chronically because when they were in functional medicine, they weren't doing that very much. And then the ER, obviously you're not doing the chronic management. So they really needed some additional pharmacist insight on how do we deprescribe some of these medications, whether they be antipsychotics or, SSRIs or things like that, or maybe they're, working on other, autoimmune conditions. They're trying to like get to the root cause and then come off of medication. So we have, that sort of angle. And then we also have contracts with physicians' offices. So one of the physicians' offices I go to on Tuesdays and provide services very similarly to what I did in the past in primary care. So we're expanding in all those different models. We also have some employer health relationships with companies that want to get their employees well, or, one of the companies we partner with is focused on autoimmune. So they're going out to employers, helping reduce their cost of their autoimmune medications and investing that back into the patient's health by addressing this root cause approach. So lots of cool things going on with Farm to Table and the pharmacists that we have all across the country. I think we have about 30 pharmacists right now, and then we cover about 40 states. So we still have about 10 states that the pharmacist licensure thing is like more difficult than physicians to transfer back and forth because there's this law test. Although there was this, the National Association's Board of Pharmacy put out this resolution that they want to get rid of the law exams in states and put questions on the NAPLEX related to federal law. But I've not seen anything since last October, like as far as actionable things happening with that. So we'll see what happens. But I wish the states would get to a point where we could at least have a telehealth. You know, when we're doing this consulting, I don't necessarily need to know the dispensing laws, right? If I'm talking to a patient from a consulting standpoint. So I was hoping that COVID would open up some of that more conversation about, you know, even in pharmacy and these expanded roles, like, can we have a telehealth certificate or something allowing us to do that in your state? But I realized early on that, like, I'm not going to go get licensed in 50 states. So I'm just going to, and I also didn't want to be the one, from a burnout standpoint, doing the patient care 40 hours a week and feeling like I was the only one that could help people. And so that's really where coming and saying, okay, who wants to do this with me? How can I help train you what I've learned? And you guys can also teach me, because I don't know everything. And so alongside, we have like grand rounds. Last night we had grand rounds. We 8 p.m. One Sunday a month. We all get on, we talk about patients, we, you know, help each other with those things. So it's just been a really good community and being able to learn and grow. And also I feel like we've moved forward like 1,000% since that point in time where it's like, okay, who wants to do this? And because we're doing it as a group and we can, you know, all have this common goal instead of everybody sort of siloed trying to figure out how to do it on their own.
Goodness, there's so much to unpack there. So just to kind of recap your journey. So you had your own personal experiences in your life that kind of motivated you to start writing and kind of posting this information online. Yeah. So you started the blog. And
I'm not a writer whatsoever. Like, I hated English.
I know blogging is tough. It's a tough market to get into. But so you had some motivation behind, you know, getting that started. And so then you started to kind of build a following to some extent, and you realized that there was a vacancy, I guess, in the market per se for CE credits and just other pharmacy education. And so then you said, wow, this is a great opportunity for me to maybe like create some resources, fill that void, and then also get some compensation for my time, essentially. Yeah. And so then you started doing conferences, and you then took the money from the conferences and then rolled that into creating, did you say
investing
EHR?
Into this bigger. Yeah. So we didn't develop our own EHR, but it did cost us some money to get our sort of vision built out on a current platform that was already available. Yeah. So we partner with Azova, which is a product that is a telehealth platform. And one of the greatest benefits to us there is that they have a group of physicians and, you know, when we have a patient that might need a medication or even like silly things like CGM, I'm like, why as a pharmacist can I not send a prescription for CGM without a collaborative practice agreement, right? Like, it's the same as a glucometer that we can buy at the pharmacy. So things like that, like we can create a visit type where like the patient can, you know, just log in and do a quick visit with a provider to get a prescription if they need to. So really trying to make this type of healthcare more accessible, because especially in rural areas of the country, like it's just not available to them.
Absolutely. That's so cool that you were able to find this company so are the collaborative practice agreements that you operate under also kind of like, did you find them independently, or were they part of this like EHR program that you found?
Yeah. So we don't necessarily have collaborative practice agreements with the physicians on the telehealth network. Partly due to collaborative practice laws in every state are different. And so it's sort of a nightmare in that regard. But in Ohio, so in my experience with collaborative practice, I do have collaborative practice with a physician that I work with on Tuesdays. And then we also have the Profero team. We partner with Profero team, that's a whole nother podcast. We could bring Mark on and talk about that business model. But we do have pharmacists out in clinics, and we utilize collaborative practice in those spaces as well. So a lot of it is just networking and figuring out, you know, who needs help and trying. And honestly, like, I know it sounds silly, but I love talking to drug reps. One, I love the information they provide, and I know some people have very different opinions about that. But I do find there's a lot of value in the information that they have, especially patient education materials when it comes to diabetes, and oftentimes are unbranded education materials we can share. But they're also the ones out there in the community talking to providers all day long. And so actually, the last job that I had, I worked for 6 years in a primary care clinic. One of them, who worked for a device company, came to me and said, Hey, Melody, this office really needs a nurse practitioner. And I said, oh, my friend, I was actually looking for a job for my friend who was graduating NP school. And he's like, well, can she manage diabetes? Because he really needs help with that. And I was like, well, I don't think she wants to do that, but I can do that. So then we went and met with him together and presented our proposal. And he like sort of knew we were like a package deal at that point. And he hired both of us. He said, okay, I want to do this, but I don't know how much I can pay you. And I was like, okay, we're gonna have to figure that out first. But anyway, so I think a lot of it is networking. And again, I know that sometimes pharma is frowned upon, or relationship with pharma is frowned upon, but I've provided better patient care because of information that many companies like put out there for the patients. And then I also find the networking to be phenomenal because that's really their job, is to network. And so again, not everybody's going to agree with that, but I just found that that's been really helpful when I'm talking like locally and how to expand like within your region.
Absolutely. It's all about who you know in life and kind of using those
Yeah,
resources that are available to you and kind of using it to kind of provide some leverage to your future positions. So
sure.
I love that you were
Sure.
able to do that. And it sounds like it was pretty fortuitous at the time.
Yes.
And so you then kind of took this money, rolled it into the EHR, and then you scaled it up
Yeah.
to 30 other pharmacists. So they all work kind of like on the same team with you, or like do you supervise
Yeah.
their care?
Yeah.
How does that work?
Yeah. So they work all in the same team. So they're direct contractors. And so and we might not be quite at 30. Sometimes we like ebb and flow of
Sure.
people that leave or come back. But and certainly we're still building our audience. Like we don't have like 1 million followers or whatever, 100,000 followers or anything like that on any of our platforms. And so we're all still building. So I've told them like, I'm going to help you set up this, right? Because you currently don't have anything to see patients with. And so we get them set up in the system. We go through protocols. We talk about the core things that we help patients with. So we help patients with stress induced, hormone imbalances, or hormone imbalances in general. We help patients with gut disorders. We help patients with thyroid and autoimmune conditions. So those are like the big ones, metabolic syndrome. So we have sort of some sets of protocols and education materials for each of those disease states. So we go through that with our pharmacists that we onboard, and then we also provide them coaching. So we have some phenomenal coaches that are trained in like mindset coaching, which is not me, but I have, and one of them is one of the early adopters that said, "Hey, I want to do this too," and so she's been with me the whole time, and so she does a phenomenal job. Her name's Nicole Grams. We also have Sarah Boschhofer, but they both are talking to our new pharmacists. They do 4 or 5 sessions with them at the beginning, helping them sort of figure out the game plan. Okay, what do you want to focus on a particular condition? How are you going to market yourself? And do, that plan with them on, because so many pharmacists, and I'm sure physicians are like this too, but if we're not taught entrepreneurial skills, or, I mean, might be a business class, there's like a module, but in my training, it was very focused on how to run a pharmacy and like the ins and the outs of the money that was coming,
It's a tough market
and
these
like
days.
how to. Yes, yes. And so it's like not even relevant to most of us. And so we have that component, sort of like the business tools component, as far as and also the education component. But at this point in time, like I can't say you're going to get a ton of patients from being on our platform right away, but it's going to be a 50-50 effort. Like we're going to be on the podcast talking about these things. Patients are going to listen to that. We're going to put money into some marketing on Facebook or different platforms. And then we're going to equip you with the conversations. And we've created, classes on some of those core imbalances, and they can go out in their communities and teach these classes, but they didn't have to put the slide deck together or the pamphlets together. Like that's already available to them. So really just encouraging. So it's almost like they're still independent contractors. So they can still, do what they want necessarily with their patients or their business, but they're still under our umbrella. And so we're all sort of working together for this mission. So I would love to say, if people are out there and want, we are still working on, getting to those, employer health contracts and lots of other, opportunities that we have. And that's growing daily because, just my relationship with Mark and Profero team, and he's got we're working together on growing some of those services. But so it's still a journey. Like I don't have like 1 million patients being seen or anything like that at this point. But I think the satisfaction, even if a pharmacist is still working retail, but they're on our team, and just the satisfaction that they have of really helping people in this way, even if they're only doing 1 or 2 visits a month or 1 or 2 visits a week with patients, they really find that rewarding, and they feel like they're actually able to, take the time to give back this knowledge. I know I've been faculty, like I mentioned, for almost 10 years between full-time and part-time. And I've interviewed lots of pharmacy students over that time. And everyone says they want to go to pharmacy school to help people. And so many pharmacists right now are just not feeling like they're doing that in their daily job. And so I really feel like this gives them an avenue to do that. So yeah, that's where we're at. But it's really just like we're helping them get to set up that business structure so that then they can do that. They can, go out into their communities, whether they're, talking to their chiropractor or their local physicians. I mean, sometimes I get referrals from local physicians that I have relationships with, or nurse practitioners. Sometimes it's, talking to massage therapists. We have one pharmacist that gets all kinds of referrals from a hairdresser in Chicago that she used to go to. And I've thought about this, like my next marketing ploy, maybe going to or marketing like plan, maybe going to like a hairdresser convention and like helping them, because then they're going to tell, how many people like tell their hairdresser everything. I don't know if you know as a male, but women, like the hairdresser knows everything about you because they spend, especially people get their hair colored, they're sitting there for an hour or more telling them about their life. And so anyways, so I got to keep that in the back of my mind. So if anyone listening to this knows the best hairdresser conference, maybe one of those organic, like newer hairlines might be a place for us to go.
Oh my goodness. I'll have to keep my eyes out for it too. I don't frequent hairdressers too often, but
I know.
No, but that's so interesting. You're understanding the niche and the market and the clientele.
Yeah.
And that's obviously just like you said, a megaphone for your business.
Yeah.
Right? So
right.
And I think it's so cool that you're creating the frameworks for like your other pharmacists that work under you as contractors.
Yeah.
So like you said, individuals who don't want to deal with the business side of things, they just want to reconnect.
Yeah.
With
right.
the patient care.
Yeah. And I want to make sure we're providing a, consistent service. So I do like periodically review charts and, help. Again, they can reach out. We use Slack, which is like a business tool, and we have like clinical questions channels and specific channels that they can ask questions in, and excuse me, other people throughout the week, can answer. And so that's, always an option too. So I think really just having that team support, even though you're like, so you're not feeling like you're doing this in a silo, and that you can really, get the benefit of everybody's experience.
Absolutely. And then additionally, like my next question kind of falls along the lines of marketing in some sense, where would you be able to tell me about like, what was the impetus for starting Table Talk podcast and how it's kind of grown?
Yeah. So my husband has had a podcast for a while. So his podcast is Your Website Engineer. And I know just like he like, it's amazing. Like you start these podcasts, or you start talking about these things, all of a sudden you're talking to people from all over the world, and you have just like this like larger impact and in a footprint, I guess, because some people are audio learners. I am one of those people. Like so much of what I've learned about functional medicine is from guests that come to Kara Fitzgerald's New Frontiers in Functional Medicine podcast. And then now Raabe has a podcast with Carrie Jones. And so I used to spend a lot more time in the car. Now, not as much, because the office I spend a lot of my time in is like 3 minutes from my house. But when I was spending a lot of time in the car, I was like, okay, I have so much time right now, and I'm going to like listen and learn. And so I feel like there's a lot of other people out there that are like that. So when it's blog, some people are just not going to read that, right? They're just like scrolling. They see like the title, they might click on it, but sometimes they're not even going to read the whole thing. So I think part of it is getting like a new medium for information. Like we might be talking about the same information we're talking about on the blog. But then the other part of podcasting that I think is really unique is the relationship piece. Is like when you listen to people talk, especially if like they're the same host over and over, you learn about them and you feel like you have a connection with them. And so, I don't know, there's this one family called the Holderness family, which you may know because they have like crazy videos online, and they won the Amazing Race recently, but I feel like they're my friends sometimes, like, because I listen to them and, hear their like back and forth. And so I really wanted to, and also with healthcare, I think the Table Talk name, there's a million other podcasts called Table Talk. So if you're looking of ours, not millions, an exaggeration, but if you're looking for ours, you can go to our website at PharmToTable.Life, and which Pharm is PH, and then click on podcast and find it. But I really liked the idea, and Nicole, I have to give Nicole Graham's credit for help with this name, but that we were just like sitting around the table having these casual conversations about health, and that it wasn't this like scary, think about white coat syndrome. People are like nervous to go talk to their providers about things, but that these are like common things that people are dealing with on a daily basis, and that it's it's not any different than having those conversations with your girlfriends. And again, women is probably like our more target market. If I'm going to spend advertising money, I'm not going to select the men as an option to get our ads in front of. That's a whole nother conversation about how men just don't approach the healthcare system even the way that women do, and even in the regular healthcare system. But so that's part of it, is really just having these conversations, these real conversations. So right now, like, it's me, but then it's different members of the team that are coming to the table. And so we're sort of having this virtual table. So I wish that we could meet in person all the time. But the picture that we have on the image of our podcast is us having a dinner on a farm back in Chicago a couple years ago with part of the team. And I feel like that image is what I want people to virtually feel like, that they're sitting down with us, having a conversation over a nice farm fresh dinner, and that we're, all working together in that community feeling.
That's so cool. I'm going to have to work on my my podcast star, because it's a Chiari-1 malformation, so I can't really bond with people over that.
Yeah, but it grows. You have to change everything. You can't get it all right the first time.
No, but you're definitely right. Like, it's such an interesting thing, just like studying the market and where people's eyes are going, and more importantly, their ears. Like, people aren't reading blog posts as much. They want that fast, immediate stimulus, or they want their answers so quick. Yeah. And a lot of that,
I want to put it on 2x.
Exactly. Yeah. I only listen to things on 3x now. I have like a
3x. Oh my goodness. I can't do that.
That's great. Get through all my modules much faster. But
yeah.
Anyways, so I think that's just so cool that you've kind of moved into this medium where you're able to kind of just like you said, bond with other people that you're interacting with. And you're right. It opens, like I'm talking to you for the first time, and it's just so cool. And now we're going to have a connection like this that we can share and reflect on from a long time to come. So it's very cool.
Yeah.
And so additionally, I just want to I know we're getting to the end of the interview today, but I just want to wrap up. So for someone who is interested in like starting their own business in the pharmacy world, or wants to get more involved in your particular niche, what kind of recommendations do you have for them?
Yeah. So if you're looking to get involved in functional medicine, like I mentioned, we have the website functionalmedicinece.com, and we have after this releases, we will be having an in-person meeting in Nashville. So you'll find that on our website. That's going to be September 23rd at the Gaylord Hotel, which is fabulous in Nashville. So you can join us there. The topic there, we're covering cardiometabolic conditions. So it'll be really relevant to so many of us, because we all see patients at risk for cardiovascular disease. I mean, whether you're at the airport or you're in a mall or something, like you're looking around and you're like, oh my goodness, how did America get like this? I don't know if anyone else is like that, but that's what I think about when I go out these days. And there's so many reasons for that, but that's a whole nother podcast, which we've done, I think. But anyways, so that's going to be September 23rd, 2023. And then we also are going to be diving into men's health in November in our virtual conference. And then we have a lot of on-demand education and past conferences that are available for people to take a look at. We've done pain, we've done gut health, we've done women's hormones, we've done anxiety and depression, which is a big conversation right now from a functional approach. So lots of great information. I mean, other places, Institute of Functional Medicine is there, and they have annual meetings. They have online education. So does A4M, which is another organization. The American Academy of Anti-Aging Medicine has a functional integrative track. So definitely those are the big ones. And then I think, like I said, podcasts, finding the right podcasts, listening to those if you're, finding quality information ones. But I do love New Frontiers. You can listen to ours. And then shout out to Carrie Jones and her Root Cause Medicine podcast as well. So those are some places to start. And then if you're a pharmacist, also connect with Functional Medicine Pharmacy Alliance, so FMPHA. There's a Facebook group for functional medicine pharmacists. There's a community there as well. So we have free webinars as well on our site. So you can come over to the site and join the email list and make sure you can get access to some of the free content, sponsored content as well. So there's lots of great places. From a business standpoint, I'm not sure if I'm the best person for that, but we did have a business conference actually. So I could point back to that, and I can link some of these things for you if you have show notes. So that might be a good place to start. And then also Blair Thielemeyer is called Pharmapreneur. So she's out there, which if you haven't interviewed her, you should interview her on this podcast as well. But she really helps people set up the stage for business and becoming an entrepreneur as a pharmacist. So I would say those are great places to look.
Fantastic. And I'll link all of that information down in the show notes.
Yeah.
Additionally, so I have two final questions before we kind of wrap up
Yeah.
the episode. So there, and this one's kind of building off of the entrepreneurial spirit, and it
Yeah.
is, what is it that sets successful entrepreneurs apart from those who fail?
Yeah. So I think there was some conversation on LinkedIn about this recently, but I think like the whole term like progress over perfection is huge for entrepreneurs because so many pharmacists and probably other medical providers are very type A. We have to have everything perfect. I'm not actually, but but I feel like that served me well as a little bit. But some people get annoyed with like the conversation. There's this group called Pharmacist Moms Group, and like people are always like taking a picture of this bottle where like the top of the bottle, like the foil is like not pulled all the way off. Like that drives most pharmacists crazy. Me, I'm puncturing the bottle, whatever tablets fall out. I don't care what happens to the foil. So anyways, so there's this perfectionist mentality in a lot of healthcare providers. And certainly we have a reason for that to be the case, right? We're like life or death for a lot of decisions that we make or calculations that we make that have to be perfect. So, but that aside, like building business does not have to be like your IV, right? You don't have to be perfect in every step of the way for building a business. And so I think that you have to do something though. You can't be paralyzed by the fact that it's not going to be perfect and amazing and sort of that like looking around at everybody else and looking like, oh my goodness, this person has $100,000, this person has 200,000. Why am I even trying? They're already doing it. Like that's not the case. Like there's so much room in healthcare for innovation. And so if you've got an innovative idea and have that need or that there's a reason that idea needs to solve a problem, you have a problem to solve, then really just taking the next steps and figuring out what that looked like. And a lot of the times it won't always be the same as you started, like the picture that you started with or the design. I mean, same with engineering, right? They design something, they try it out, it doesn't work. So they, redo the design. And so we just have to think of it like that and really just make steps to move forward and don't get paralyzed by, looking at everything else that's going on around you.
Yeah, I think that's such great advice. Like I definitely fall victim to it. And I'm sure you have too, where you're just sitting there and you're thinking about like, oh, this blog post would be such a good idea. And then like, I'll sit here and I'll comb over it for like 3-4 days. And then I'm just like, what am I doing? I finished it 2 days ago. Like I should have just posted it already.
Right.
And so, but I'm just waiting like, oh, it needs to be perfect. Oh, I need the perfect like caption and title. And some of that stuff like kind of leads to paralysis when it comes to business minded.
Yes, exactly. Analysis.
Exactly. So yeah, don't fall victim to that for any of our entrepreneurs out there. And then additionally, what are your personal, professional, or business-oriented goals that you would like to accomplish in the next 5 years?
Yeah. So I guess I would like to have more like employees in the next 5 years to where we are able to expand more and a lot of like the administrative things being taken off my plate and put on to some other people. I have hopes actually in this year of partnering with Profero team to launch a integrative metabolic center in our town. So that's on the 5-year plan, but hopefully sooner than later. But sort of a concierge model there. So hopefully by the time this podcast edits, we're further along, or releases, we're further along with that. But so professional, goals, I think for me, like, I don't know if you probably follow YFP and maybe that's even where I saw you. But I think from a financial standpoint, getting to a place where, we're not always having to worry about like the month to month thing. And part of that is our own fault for like me transitioning out when I did into my own business. I just got a little bit behind, on some things and, just really, be in a better place there in the next 5 years. And then probably with savings more in particular, not that I'm behind on bills or anything, but just like more like better savings for our kids' college. And, we want to continue to send them to private schools. Our kids go to Spanish immersion school, which is phenomenal. If anyone's listening to this and you're thinking about it, absolutely. My 9-year-old is fluent in Spanish and it's amazing. So 100% worth every penny, but sometimes you look at those bills and you're like, oh my goodness, you could go to school for free, but I'm paying these things. But, so those kinds of things. And, but just really, I think like prioritizing that, our church and, we host a small group every week and just continuing to like be engaged in our community, and not feel like we have to like work all the time. Cause I think as entrepreneurs, we also like, just feel like we always have so much to do. There's like no, you don't shut the door at 9 to 5 and, here we are at 7 p.m. Eastern, like doing a podcast, like it just continues. And so finding that balance, because my daughter's already 9. I don't know how that happened. But finding that balance of, okay, we've got 9 more years of you living here, and like, let's, figure out how to enjoy these. But also it's so hard as balance. I feel like we should just be able to work like after they leave the house, but it's not like that. You have to like build these things so that someday you have, that to be able to enjoy. But it's the work-life balance is always a struggle. So hopefully I've figured it out better in the next 5 years.
Yeah. And you referred to YFP there. That's your financial pharmacist. And I actually do have an interview with Tim Olbrich, episode 4, and I'll put that in the show notes.
Yes. Awesome. Yeah. We went to college with Tim.
Oh, no kidding.
So my husband probably has stories that he could say, but I don't have
Not on the air, of course.
Yeah, not on the air.
Fantastic. And you're definitely right. As a business owner, it's so hard to turn it off sometimes. And, what I found is that sometimes like when you do like have the control and you do turn it off and you come back after a few days, you're so much more like recharged and reinvigorated.
For sure.
And the clarity is so much better when it comes to kind of like where you want to take things. So.
Yeah. But as far as other business goals, I mean, I definitely want to be engaged in more employer health programs and wellness programs, and maybe not even us selling our own program, but just really partnering with other places that need additional clinical support like this, whether that's companies that focus on mental health or companies that focus on autoimmune or diabetes. So really just, creating those relationships that we can take what we've built and, sort of merge with their product or their, offerings and, really just create like a really improved model.
Absolutely. Well, I'm looking forward to seeing all this great success over the years.
Yeah.
All righty.
Awesome.
Well, we've come to the end of our interview, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey or other non-traditional pharmacy careers, check out my website at www.physicianpharmacist.com. Before we let you go, Dr. Hartzler, how can our listeners learn more about you or get in touch?
Awesome. Yeah. So you can check out our website, which is PharmTotable, PharmToTable.Life, Life. And again, /podcast if you're looking for the podcast, or /blog if you're looking for the blog, or you can make an appointment there if you're looking for healthcare like this. And then the Functional Medicine CE website, again, is functionalmedicinece.com. And that is geared towards pharmacists, but other healthcare providers could absolutely join. I will say we're actually taking a cruise. I didn't mention this, but 2024, we are doing a lifestyle pharmacy medicine cruise. So we are planning on offering CME on that cruise. So if anyone would like to go to Alaska with us and get pharmacy CE or medical CE, that's going to be July 2024. So lots of exciting things coming up. And I'm also on LinkedIn, Melody Hartzler, and PharmToTable.Life on Instagram. So, and I'm on Facebook too, but I feel like that's not where pharmacists are these days.
Oh my goodness, you're having a cruise? I'm going to be on residency at that point, but I might have to take a week off. Oh
yeah, they probably won't let you take the first month off, right?
Probably not, but I'll see if I can pull some strings.
Yeah, for sure. So yeah, just get the whole group to go, right? Like everybody, we're going to go learn about this for a week. It's part of didactics.
Perfect. I do need some CE, so that could be very helpful. All righty. Well, thanks again for being on the podcast. I recognize you're an extremely busy individual, and I really do appreciate your time.
Yeah, thanks for having me.
Take care.